morning. Everyone ready? Yes, good to go. Today in Queensland we're reporting 16,812 new COVID-19 cases. That includes 5,572 rapid antigen test positive results that are reported by individuals to Queensland Health. That means there's 91,306 active cases. We did 37,622 tests in the last 24-hour period. Tragically, 9 Queenslanders died from the virus in the last reporting period, bringing the total number of deaths from the pandemic to 72. 850 people are in hospital, 48 in intensive care, 20 of those are ventilated. 88.91% of eligible Queenslanders 16 plus have now received their second dose of the vaccine, and we have secured through our Queensland Health stockpile 985,184 rapid antigen tests since the 9th of January, and we continue to pursue all opportunities to get additional rapid antigen tests available for Queenslanders. Right now in Queensland, tens of thousands of Queenslanders are isolating at home, either because they've had a positive COVID test, they're a close contact of somebody who is positive, or they have symptoms and have not yet been able to get tested. Quarantine and isolation have been important public health tools right throughout this pandemic, and we expect them to continue to be so. Right now, there are 1,875 people in hotel quarantine. That's about half of our hotel quarantine capacity. Of course, that number will reduce on Saturday when those new rules for international arrivals come into place, but we do expect an ongoing need for quarantine for arrivals, including those who are unvaccinated or who come from countries where their vaccination programs include vaccines that aren't recognised by our TGA. The federal government has asked us to retain an international arrivals cap outside of those allowed to arrive without quarantine at 350 a week, which gives you a sense of the kinds of numbers that we might expect beyond Saturday. There are also 262 people currently in hotel isolation. They're people who've been directed into hotel isolation because their accommodation is unsuitable for them to isolate. So that's homeless people, vulnerable people, travellers whose accommodation may no longer be available, whose hotels might have said that they cannot isolate there, and others who might have people in their household who are vulnerable. For example, they might have a disease which means that they are immunocompromised. And so an ongoing need for suitable quarantine and isolation accommodation is certainly the current case. The Queensland Health and the Quarantine Governance Board have carefully analysed these numbers to determine how we should use our new Queensland Regional Accommodation Centre at Wellcamp. This is the first mix. It is how it will be used when opened, but we should expect this to change over time. The first 500 beds, as you know, we will begin to put guests into in February. The facility itself is broken into pods of 250 beds. So the first 500 includes two pods of 250. These pods can be operated individually and for different purposes. And so the decision has been made that on opening, the first pod will be used for those travellers who still need to quarantine, unvaccinated travellers, for example. The second pod will be used for Queenslanders directed into isolation because their accommodation is not suitable. That will allow us to downscale the number of hotels that we need. We will continue to need some hotels in other parts of the state and one close to the airport until the Commonwealth's Pinkenba facility becomes available. As I mentioned, we should expect this mix to change over time as the pandemic response changes. Its utilisation and the utilisation of hotel quarantine has changed over the last 2 years and, as I say, will continue to change. We have a program board responsible for making those decisions about how we use the Wellcamp facility and hotel quarantine, and today we're announcing the appointment of a quarantine commissioner. I'm very pleased to announce that Queensland Fire and Emergency Service Assistant Commissioner Joanne Greenfield Longfield has been appointed as the Quarantine Commissioner to work with the Governance Board to oversee the administration of isolation and quarantine in Queensland. She's here with us today, and there'll be a chance for her to introduce herself and to answer your questions. We're coming to you with the COVID update today from Antiotech. Antiotech is a company with a rapid antigen test approved for use in Europe and the United Kingdom, and we are supporting them to build a manufacturing facility here. Right now they're manufacturing in Spain, and they have capability in Spain to scale up to provide additional tests, and we hope by around the middle of the year a capability to produce roughly 1 million tests every month. You'll also be aware that the government supported Loom to develop their rapid antigen test, which is currently approved for use in the United States, and they have supplied millions of rapid antigen tests into the United States, including all of those manufactured here in Queensland. For most of the last 2 years, we've relied on PCR testing, but now, as you know, as we increasingly rely on rapid antigen tests, it is urgent that we get more rapid antigen tests approved and available in Australia. And if we can have them made here, then we avoid all of the import and competition issues associated with trying to get a product that is in demand right around the world. And so we continue to support companies like Antiotech and Loom to get their products approved for use here in Australia and get them manufacturing here in Australia. The fact is, we should have Australian workers making tests here in Queensland that Australian workers can use to get themselves back to work so that they can be stocking our shelves, ensuring our supply chains, making sure our essential goods and services continue. And that's why we're supporting companies like Antiotech and Loom. I'll ask the Chief Health Officer, and then we have the Health Minister, the Quarantine Commissioner, and Derek from Antiotech to address you.
Thank you very much, Deputy Premier. Sadly, today we have 9 deaths to report. These include an 18-year-old with significant underlying medical problems, a person in their 70s, 5 people in their 80s, 1 in their 90s, and 1 person over the age of 100. Of these 9 people, 3 were unvaccinated, 5 were double vaccinated, and 1 had had a booster. Our thoughts are very much with their families and friends today. With regard to the hospital situation, we have 850 people in hospital at the moment. This is up from 835 in the preceding 24 hours. These are numbers as of last night. That figure of 850 includes 48 patients in ICU, which is stable, so slightly down. In fact, in the preceding 24 hours there were 52. So the situation is as expected, that the pandemic continues its march, and our projections are, as they have always been, that the peak of the pandemic will be approaching sometime in the next 2 to 3 weeks, towards the end of the month. I'll now hand over to the Health Minister.
Thank you. I'd just like to echo the sentiments of the Chief Health Officer. It's very sad to hear of these deaths overnight, and we do want to remind people about the importance of being vaccinated. So it's important people jump online and see where they can get vaccinated. I was really pleased to see yesterday that there are many, many bookings available at pharmacies and GPs now, for both boosters and also for young people. And also there is more bookings.
Sorry, Minister, we just have to do a battery change. Apologies to everybody. Sorry, Minister.
There are also new bookings coming online every day at the public vaccination clinics. So you may already have a booking in February or March or later. Be checking these sites daily. What you may find is that there's earlier bookings. You may be able to get in tomorrow or in the next few days and bring your booster shot or your child immunisation forward. So please be checking those. We are still taking walk-ins as well at many of these clinics, and we do encourage people to come forward and get vaccinated as quickly as possible, because the evidence is pretty clear now that the proportion, the majority of people who sadly are ending up in our hospitals and our ICUs and certainly passing away from COVID, the majority of those have not had a booster, and many of those have not had any vaccination or full vaccination of 2 doses. So I also visited the Gold Coast University Hospital yesterday with Dr. Gerard, and can I give a big shout out to the staff down there? They're doing an incredible job because they are dealing with the largest number of cases across the state at the moment. They will be the first region to actually see the peak happen, which we're expecting a matter of days on the Gold Coast. They told me anecdotally in their testing clinics next door, they're seeing about 70% people coming forward now being positive. The new temporary buildings that have been set up to triage COVID patients, but also to manage people coming through ambulances, we are seeing such a significant improvement, and the supervising paramedic told me yesterday that they're seeing 2/3 of a decrease in lost time from those ambulances offloading those patients because of the new system we've implemented on the ground, which is just wonderful news. But we've got 7 dedicated wards now out of about 25 general wards in the Gold Coast University Hospital that are managing one disease, COVID. And it just shows you just how contagious this virus is. And I do want to thank the staff, and particularly those managing the COVID patients there. And please, everyone, just come and get vaccinated. The last thing, what my paramedics did say, people are calling 000 and expecting that an ambulance is going to turn up and be able to give them a free rapid antigen test. The paramedics are not carrying the tests. Those tests are done in our hospitals. That is not a reason to call an ambulance. Again, do not call ambulances for simply to find out. Don't call 000 just to find out where you can get a test or to see if you can get transported to a vaccination or testing centre. And my last message is this. I know that it is scary to hear that you've got COVID. But if the symptoms you've got in any other situation other than COVID is attached to those symptoms, if you would not have called 000 because of those symptoms, then you shouldn't now. So it's just because it's COVID that's causing those symptoms. If the symptoms themselves you would not normally call 000 and you do not believe you need to go to hospital, then you don't need to call 000 now. But if it is life-threatening, if it is an emergency, or you are feeling short of breath and those symptoms that the Chief Health Officer has talked about previously, please come forward and seek help.
Thank you, Deputy Premier, Minister. Good morning. As the Deputy Premier said, my name's Joanne Greenfield and I've been appointed as the Quarantine Commissioner. I've been involved in the quarantine programme since the beginning. I've got a health and a disaster management background. It's been a coordinated effort and we aim to continue that with the bringing on of the Queensland Regional Accommodation Facility. That facility, as the Deputy Premier says, stands us in good stead for the future as well as the current needs for isolation and quarantine, and it's great to be here today. Thank you.
Minister, can we, just while we're on the topic of health, I just wanted to ask, on the surface, and I'm sure you'll explain this, but on the surface to the layman, the reports about union delegates being able to access hospitals unvaccinated, one, can you see that would seem to be kicking sand in the face of health workers? And two, politically, can you see why pundits accusing the Labor government of once again singing the tune of the...
Can I say, it would be reasonable for people to assume that based on the way the story was written today. The story's not accurate. To see that headline this morning saying that union officials can go freely in and out of hospitals unvaccinated when my office specifically provided advice that it is only in an emergent situation. It is not for normal visits to visit tea rooms and delegates and members on the floor of hospital wards or anything else, is completely inaccurate. So if there is, for example, a death on site where there needs to be a workplace health and safety union delegate urgently called, the same as a fire and emergency, we have allowed those exceptions. It is in extreme, exceptional circumstances. It is not a normal right of entry provision that says any unvaccinated union official can go on site. In fact, the majority, if not all of the health unions have a mandatory vaccination for their own staff anyway. I am not aware of one incident or one circumstance where an unvaccinated union official has access to health site under that provision as yet. So to have that heading to make people believe that they are just coming and going and moving around freely in the hospital is just not accurate.
There's a big push again today for people to get the booster shot. Does it concern you that almost 60% of the Queensland population is not eligible for the booster?
So we're looking at the changes at the moment. We're giving serious consideration as to whether the 3-month mark should be brought forward. Remember, it was the Commonwealth that announced the timeframes for the 4-month benchmark and the 3-month. The Commonwealth announced the 31st of January for the 3-month. However, I know a number of states have already moved on this. The Chief Health Officer and I are briefing on this at the moment and giving urgent consideration as to whether we do bring the 3-month mark forward. I want to make sure that the pharmacies and the GPs would be ready for that if we did do that. But also, my message is this: there is still 40% of the eligible population, so people who have had, it's been 4 months or more since they had their second dose, 40% of those people haven't come forward yet to get vaccinated. So can I speak to those people today, irrespective of when we change the 3-month threshold? Please, if you're already at that 4-month mark, come forward and get your booster straight away.
The 3-month threshold is in fact introduced, would it still be a concern that as of the 20th of October, only 58% of people had the double dose, you still have 42% ineligible, protection against Omicron at the height of this latest coronavirus?
Well, I'd have to check where you're getting those figures, because the 3-month, no, the 3-month, yes, that's the current numbers. The 3-month mark, though, you'd reevaluate how many people fall into that category. But even at the 3-month mark, yes, there will inevitably still be some people who aren't eligible for the booster. People under 18 are not eligible. Those are decisions that are advised by AHPPC, and the Commonwealth gives the guidance. It's not the government who decides whether it's under 18s or not. And I'm not aware of any advice from the Commonwealth, from their medical officers, that we can go less than 3 months at this stage. So we have to stick with the health advice and the guidance. But that does mean, for those who aren't eligible, whether it's a 3 or 4 month mark, still come out and get your 2 jabs. Please get both vaccinations, because they still make a big difference. People shouldn't assume if I can't get a booster, I'm not going to get protection. 2 doses still give you some protection. So quite a few people have already left employment, both through the show cause process, and their employment has been terminated, and a number have chosen to leave their employment. So there's quite a large number who have already moved on. There's a number that are still going through an exemption process. So as people understand, procedural fairness, they will not be shown cause as to why they shouldn't be terminated while they've still got an exemption request in place. However, I've asked all chief executives of every hospital and health service to have all of those exemption applications determined by the end of next week. And where someone is not granted an exemption, they will be issued a show cause as to why their employment shouldn't be terminated if they remain unvaccinated. Oh, I can get that number for you. I don't think it's thousands. We've got 95% of the workforce vaccinated now, so we're certainly not talking in the thousands who have left the employment of Queensland Health.
This process will have to give it teachers, I suppose.
Sorry?
The process will have
Yep.
I think about 1,800 at this point that have said they're not going to get vaccinated. What's the plan to cover that shortfall? I appreciate it's not your
Yeah,
fault.
so the Education Minister talked about that the other day. They do have a reserve workforce that can come in, teachers and teacher aides, not just for the unvaccinated, but also when we have staff furloughed because they're positive and they're in quarantine as well, because they're close contacts. So we're considering all of those. What I do know, we've seen it in health, we've seen it where else we've aged care. Our aged care numbers, almost 100%, which is fantastic. What we do know is, although people say no now, when the crunch time comes, there is a shift. And even some of those people who were part of the Supreme Court challenge for our health workforce, some of those went and got vaccinated.
The Health Minister said Novavax has been approved in Australia.
Yes, I've just seen
Are you
that.
anticipating that there will be some that have been holding out for that particular vaccine? What sort of number do you think that will boost by?
It's hard to say. I certainly have met people who, as I've moved around the state, say they're waiting for this. This being available, and I know that the Commonwealth announced it today, it's still got to go through a target. But once it is available, and then find out when we get our supply, we will see an increase. What proportion that is, it's hard to tell. So.
Can I ask, is the delay in opening Wellcamp because the government's been trying to figure out who to accommodate there?
No, the delays, which are only a few weeks when you consider it, were largely caused by the weather in Toowoomba around October and November, and some delays in our contractors securing staff. The workforce shortages affecting the entire country also affect the contract providers who we have engaged to deliver health and other services at the facility.
Why do checking with these, will international students be among the cohort or will it just be unvaxxed?
So from Saturday, those restrictions on international arrivals who are vaccinated will be relaxed, and so it would only be unvaccinated international students or students who come from a country where their vaccine program isn't recognised by our TGA, who would have to go into that facility. That has freed it up for us to then use for the surging number of Queenslanders who need to isolate because they're either positive but not so sick they need to be in hospital, or they're close contacts with a household which is unsuitable for them to quarantine.
Do they apply for a Deputy Premier, or do they just show up?
In most circumstances, they'll be directed by the health service. So,
Value for money though, given the travel changes on Saturday.
yeah, incredible value for money. At the moment, they are in hotels facing the same dangers that we saw with quarantine hotels. And prior to, when we put them into hotels, they were occupying hospital beds, which are just about the most valuable thing in the state right now, even more valuable than rapid antigen tests.
Why do we need a quarantine commissioner 2 years into a pandemic?
Because we expect quarantine and isolation to continue to be amongst the public health tools that allow us to manage this pandemic. They are right now. They have been for the last 2 years, and we expect that to continue. We have a lease on the facility at Wellcamp for 12 months. We have an option to extend that by a further 12 months. That gives you a sense that even 2 years in, we continue to expect quarantine and isolation to be public health tools that we are advised to utilise.
But how does
Be
the
in terms
public
of
know it?
people arriving internationally, I land, I'm unvaccinated. Is it a choice as to whether I pick hotel quarantine or am I automatically sent to Wellcamp? Do I get a bus? Do you take me there? And also, what does it cost? Is it the same cost as hotel quarantine?
So for those unvaccinated arrivals, the cost will be the same as hotel quarantine has been. Throughout the pandemic, guests haven't been able to choose where they will go. That has been a decision of those managing our quarantine system, and that will continue to be the case, as you might expect. Lots of people arrived and asked to go to the Stamford instead of the Ibis, and similarly, those kinds of decisions will be made by the quarantine system. In terms of costs, though, we don't currently charge people who are directed to isolate under a public health direction because they have unsuitable accommodation, and so they won't be charged if they are directed to the facility at Wellcamp.
Are taxpayers going around the state to Toowoomba, and how much is the government budgeted for that?
So this will predominantly be for those in the southeast. Obviously, many in this cohort can self-transport themselves to WellCamp, but others will be provided with transport. We'll continue to need quarantine facilities in other parts of the state for those who are isolating and where it doesn't make sense to transport them, and also for international arrivals in those locations. So we get international arrivals into the Gold Coast and Cairns. We expect to continue to use hotels there, as well as there are a number of people who arrive into Brisbane Airport and require quarantine for short periods of time, and in that case it makes sense to continue to have our existing hotel at the airport, and we expect that when the Morrison government's facility at Pinkenba is open, we'll be able to scale down use of that facility.
Will the positive be able to go there, Deputy Premier?
Sorry, will people have to drive themselves to this quarantine facility?
So there will be an option for people who are well enough and close enough to self-transport themselves there. Clearly, if you're well and just a close contact of somebody but don't have suitable accommodation, that's an option. But we will also organise transport where that's necessary and appropriate, as we always have.
How much have you budgeted for that?
That's included in the program budget. We've continued, and that's an expense that we currently incur with hotel quarantine. We currently move people between, for example, Brisbane and the Gold Coast, the Sunshine Coast and Brisbane. We'll continue to utilise the services that we always have.
Who's having staffing it?
International arrivals are coming into Queensland?
We don't know exactly. We do know that the Commonwealth have asked us to retain a cap of 350 arrivals per week. I expect it would be less than that number, but that's the number the Commonwealth have asked us to be available to take, and that's what we've taken into account when providing 250 beds at WellCamp to take part of that load.
Why do you need 1,000 beds then?
Well, as you saw from the figures I outlined, there are many Queenslanders currently in hotel isolation, as well as those that we expect to continue to need hotel quarantine. Those numbers will go up and down over time, as they always have, and the facility itself, as I outlined, is constructed into pods of 250 that can be activated and deactivated and used for different purposes at different points in time, according to the health response to the pandemic.
Deputy Premier, just on another matter, Alan Sutherland's case has been thrown out of the CCC. Surely now Alan McSporran's position is untenable. He must resign, because yet again we see another case thrown out of the CCC. We've seen the Premier go on the record backing McSporran. Is that the reason why he's not stepped down, and when will changes be made?
Well, some of those questions are best directed to Mr McSporran and the CCC. I've only just seen the news regarding Mayor Sutherland. Obviously, it's a matter I've monitored closely. I live in the Moreton Bay region. I worked very closely with Mayor Sutherland, but I'll look at the detail of what the court has said and take that into account. No doubt, though, this is a matter that will be considered by the PCCC as they have been.
If you were Premier, Deputy Premier, so put yourself in that position, would you have McSporran as the head of the CCC, or would you terminate him?
Well, these are not decisions made by the executive government. There is a process in place, as there should be. The CCC's job is to oversee us, and so the decisions regarding those appointments are very serious, and there are serious processes around ensuring the integrity of them.
Surely this damages people's faith in the CCC.
Oh, look, again, I'd just like a chance to actually look at what's happened and what's been said. The concerns of particularly the local government sector have been well ventilated by them and by the LGAQ. These are matters very closely being monitored by the PCCC, and no doubt there's more to be said.
They're destroying people's lives, though, Deputy Premier. Have a look at the councillors with that police officer. They're ruining people's lives by putting before a commission that is finding nothing. It's ruining lives.
I understand the point that you're making. I also, as one of the people oversighted by that organisation, as well as the local government minister, will take care in what I say about their decisions as well as the decisions of the courts. And there are processes currently underway to look at look at the way the CCC has recommended prosecutions on these kinds of matters, and no doubt the Sutherland matter will also be considered by the PCCC.
How would you rate the success rate of the CCC over the past few years?
I don't think it's up to me to rate them. As I say, I think it's important in the system of integrity that we have that people like me are very careful what we say about the organisations whose job it is.
Just before Deputy Premier finishes, just back on Wellcamp, can you run us through the staffing? Is it going to be Queensland Health staff that are going to be taking their police, and where are they coming from?
And if you test positive, can you go there?
So the staffing arrangement there has been contracted to Aspen Medical, and so while the health services will be oversighted by Queensland Health through that governance board arrangement, the services themselves will be delivered by Aspen Medical. The non-health related services will be provided by Compass, another organisation with experience in delivering those kinds of services.
How much is that costing?
That's again all within the program budget.
And the 1,875 people who are in hotel quarantine you mentioned, do you know what percentage or what number of those come out as soon as we hit Saturday? Obviously there's people that are flying for leave. Do you know how many actually will stay in there?
We don't have an exact number. The staff are working through that right now and preparing to release not just those who finish their quarantine period on Saturday, but those who no longer need to quarantine on Saturday. They'll get released early.
Just last one on people that are in home isolation at the moment. Do they need to contact anyone, do anything, or as soon as we hit 1 a.m. Saturday, can they just walk out?
Yes, provided they're sure that the directive applies to them, they can do that.
That's correct.
Yes. Can I just, there was one thing I omitted to mention earlier. We've had a second instance of Queensland Rail rapid access tests being intercepted at a supplier and diverted to the federal government. This is despite denials from the federal government that this is occurring. We have another email from a provider confirming that was the case. These tests are critical. Queensland Rail is critical to our supply chain, our logistics, and our ability to get people around the state. It is bad enough that the federal government says it's not their job to assist with rapid antigen tests. It's bad enough that they won't help us. It is worse that they are making our job even harder by taking the tests away from us that we have secured.
Dr. Gerard, there's been a big shift in the health strategy since December, and we're starting to see, unfortunately, some of the hard consequences of that. How do you make sure the public doesn't lose confidence in the strategy you're pursuing now?
Well, the strategy has always been the same. The strategy was to contain the virus until such time as Queenslanders have had an opportunity to get vaccinated, and then once that was done, to gradually reduce the restrictions on Queenslanders. It has always been inevitable that the virus would spread through Queensland after the borders were opened and the restrictions were released. That was always expected. And so what we are seeing now is an inevitable consequence of that, and all I can say is this is what was expected. So in terms of the Omicron, what goes a bit beyond what was expected was just the speed with which this virus has spread. It's a very contagious virus, and that's the one variation on what was expected perhaps in December. But it was always expected the virus would spread in some form.
How do you keep the public with you who may be shocked by that spread?
I think it's always been to people I speak to, that's always been the expectation that once people were vaccinated, the virus would be in the community of Queensland. No. The decision was made, I think, before Omicron, and the booster shot was something that was identified as a particular tool in the toolkit. But we have given. I think it's important to say we have given opportunity for people to receive the booster shot, particularly those who have had their double vaccination some time ago. That's the group that we're most concerned about. The more vulnerable, the elderly, who have had 2 doses some time ago, and they've certainly had opportunity to get vaccinated.
That's the minority, though, Doctor. What would you say to people who've got the double vaccination, having to wait for their eligibility for the booster, in terms of the difference in protection once they have the booster and without the booster, how vastly different is the level of...
Well, remember, the only difference is whether we're talking 3 or 4 months. That's the only difference. So two doses of vaccine probably give good protection up until about 4 months, but we'll move towards the 3-month period probably pretty soon. But the critical thing is the vaccine effectiveness wears off over a more prolonged period. So for 4 months is quite a short gap between the second dose and the booster. So I think for the majority of people who have had 2 doses, the effectiveness of the vaccine will still be strong at that 4-month period. But we'll start moving back towards the 3, which is now considered the minimum period for a booster.
Counterparts in Sydney have expressed concerns to those Herald and Sydney Morning Herald about the extent to which the management of COVID has been politicised.
Mm-hmm.
What's the level of your empathy with colleagues who share that belief that those waters will be unmuddied somehow?
I can't comment on New South Wales. I can say very confidently there's been no politicisation in my recommendations to the government. So since I've taken on this job, when I have given a strong recommendation to government, it has been followed.
Doctor, have you seen the announcement by the TGA this morning on their dose? The big announcement they made this morning, obviously, in terms of
the new treatments for COVID-19? Yes.
And your thoughts on it?
It'll be another tool in the toolkit for managing COVID-19 in Queensland. Vaccination remains the single most important intervention, medical intervention in controlling this virus, but the new treatments are another tool in the toolkit.
Exciting.
It is exciting. It is exciting to have something new, but I must emphasise it doesn't replace vaccination.
The numbers to a layperson, holding steady number of cases, hospitalisations, no real increase day over day, marginal. They're looking early peakish.
No, I think that no, we're not near the peak yet. Our statisticians say it's still a little while to go. So it's the next. It is exactly as projected that will peak towards the end of the month. So the numbers will increase. There's no question.
Do you know what the hospitalisation number will be at around that peak?
We're still talking at the moment. What did we say? We're 850 people. We're still talking in the low thousands.
Doctor, last year Queensland was continuing to refuse access to families who were at times vaccinated and testing negative to see sick relatives.
Yeah.
In hindsight, was Jeanette Young too slow to accept more risk and let some of those people in?
No, not at all, and not at all. The strategy has always been the same. The original strategy was a containment strategy to allow people to get vaccinated, and that required very strong infection control measures. We've seen that with the virus, as soon as you just relax a little bit, the virus will spread. We knew that, and we've known that since last year. So the strategy then was to completely contain the virus to allow people to get vaccinated, and that's what has happened.
Last question.
Updated figures on the number of health workers that have got COVID or administration, and are those staff shortages
So the number of employees confirmed as having COVID-19, this is hospital and health service, is 2,374. 1,924 staff are in quarantine because they are close contacts within the household. Mostly that'll be from community transmission. And we have 314 positive cases and close contacts in the ambulance service.
Are you concerned about any shortage in people?
with those cases? Were they the 2,000 positive cases? They're active, or are they just partners?
My understanding is that they are active. That is my understanding.
Doctor, are you concerned about any shortage of face masks with people working in hospitals and reuse of PPE equipment?
Not that has been brought to my attention. Not that has been brought to my attention. No.
And just on hospitals, 120 public hospitals in Queensland, about 7 COVID patients per hospital, but obviously the concentration of patients is commensurate where the vaccine levels are low, is that right?
Oh, no, I don't think that's the case. I mean, I think the Gold Coast obviously is where we're seeing the most significant activity, and yeah, vaccination rates are slightly lower there. I think the main reason we're seeing it in the Gold Coast is because of the number of travellers that going there. If you look at Cairns as well, there's significant activity growing in Cairns as well, and I think it's because of travellers.
That average per hospital sounds like a small number, though.
Yeah, but it's uneven. It's uneven. If you go to the Gold Coast, visited the Gold Coast yesterday with the minister. They had 7 wards just dedicated for COVID-19. That's spread across Gold Coast University Hospital and Robina, and there were plans to open additional wards as we were there.
Can we hear from Derek from NTFX, who's finally let us use his lab?
Thanks very much. Well, rapid antigen testing is a key tool for the control of this pandemic, as we now know today. And the reason you can't buy one at the moment is because obviously of a lack of supply. The reality is every rapid antigen test that is available on the Australian market right now is manufactured overseas. And we have no sovereign manufacturing for rapid antigen tests to supply the Australian market whatsoever. Our plan going forward is to build some capability right here in Brisbane to have manufacturing capability of around 12 million tests per annum, but that's hardly going to make a dent on the supply issue that we currently have in the Australian market. So we call on Australian governments generally to support us in a discussion around sovereign manufacturing of rapid antigen tests to supply the Australian market and the Australian people for this vital tool to control the pandemic.
You've been resisted by the federal government before. Have you approached Canberra to do exactly this?
We're in discussions with Canberra on this very subject now. We have had discussions with Canberra on various subjects around rapid antigen testing.
How far back to those discussions?
20 months, 2 years ago.
So in 2 years nothing's happened?
That's right. Well, as you know, up until only very recently were rapid antigen tests nominated by governments as a frontline tool. So this is a change, and that's caught the supply chains on the hop in terms of supplying the market, and that's why you can't buy one at the moment.
Have you applied to
the TGA?
Yes, we have applied to the TGA. Yes. Our original submission was in September of last year.
Did they get back to you?
Yes, absolutely. And we're working closely with them.
What did they say after that original submission?
Could we work with you to supply some more information so that we can get you through the process? And
About 10 seconds, so what happened after that?
we're supplying them some more information, and we've continued to do that, and we believe that we're in the final stages of our process now.
The TGA slowed you down, did you?
Oh, we would have liked it to have gone quicker, but we understand that they have a responsibility, and we're working with them as best we possibly can to.
It's good to have them on side now. You must have been cursing them at some point.
Oh, no, not really. I think we worked collaboratively with the TGA to get our process done, and we have a good relationship with them, and we continue to do that.
So your product is a point-of-care product, is that right?
That is right, yes.
Presumably then, where yours could be used, they're currently using the take-home ones that everyone is trying to get their hands on. Any idea of just how many tests you could have been supplying that have been caught up in the system and not going to people's homes?
Oh, we could supply millions now, and so it's a good volume. It would certainly make a dent in the Queensland need at the moment. So
You had a timely response last September, like an urgent request to get going on manufacture. How many could you have produced in that time?
Well, we've been producing in Spain, in Europe, for the European market for a while now, so we've got flexibility to ramp up our capability of manufacturing in Spain.
The go button had been hit then.
Yep, we had the capacity back then to supply the market, absolutely.
I went to your product launch, I think, in Goma. When was that?
April last year.
April last year. Was your focus then more on the overseas market?
Absolutely. Well, the Australian governments had not chosen rats as a frontline tool for the pandemic at that point, and that's why we went to Europe.
That they were a good idea.
Sorry, say again?
Well, how did you try to convince them otherwise?
Oh, we made representations to government in Canberra. We're a member of the Pathology Technology Australia organisation, and that organisation has lobbied very hard for the Australian governments to use rats. We saw that the other markets, the United States and Europe, were using rats very successfully, and that's why we went to Europe.
So where were the deputies in the minister's office? Did your office feel part?
I don't know. It was generally across the board. We didn't get a huge amount of traction at the time in a discussion, nor did any other of the manufacturers, by the way. And so you look at the likes of Illum, who have got a large manufacturing plant here in Brisbane. They went to the United States to sell their product. We went to Europe.
The government gave money, the government gave money to Illum to expand their manufacturing. When did they apply to the TGA for approval?
I understand Illum are in the process of seeking their TGA approval. They received very early on emergency approval in the United States, and that emergency approval has taken effectively all of their supply. Now that rapid antigen tests are being used in Australia, they are seeking approval here in Australia. For nearly 2 years, we were only using PCR testing, or primarily using PCR testing, and throughout that period we've supported the TGA's position that there wasn't an urgent need to approve rapid antigen tests. In fact, you'll recall at the Illume launch, Lydia, I was criticised for the fact that these tests weren't being used in Australia as part of our health response, and I defended the TGA approach at that time. But we are now in a rapid antigen testing emergency. It is the shortage of rapid antigen tests that means that there is not meat on grocery shelves. And it is not good enough for the Prime Minister to say it's not the federal government's job to fix this problem. In September, they were told their plan would require rapid antigen tests. In December, they were demanding we move from PCR to rapid antigen tests. More than 2 weeks ago, the Prime Minister said the market would fix it and it wasn't the government's job. The market has not fixed it. And so we need the Commonwealth to do everything that they can to both get rapid antigen tests into Australia and to support sovereign manufacturers so that we can be making them here so that we aren't competing with other countries to get them out of China.
We're learning a lot of corporates that were ahead of the game, they're proactive and getting ahead of buying last year. Why didn't the state government also have the foresight to get on board? You know, Jerry Harvey can get millions of them last year. Why couldn't you guys also get on board?
So we stockpiled rapid antigen tests for usage in our hospitals, but we did not foresee that the Commonwealth would not have rapid antigen tests available for the wider community. And the Prime Minister stands up and says this could not be predicted. Well, it was predicted. We know he was warned in September that his plan would require rapid antigen tests, and they failed to secure them.
Is it disappointing, though, that the government gave millions of dollars to this company to produce more rapid tests? They've gone overseas and they haven't even applied to the TGA yet?
Look, I think it's understandable given the circumstances, and I defended this at the time. I said that at the time it made most sense for rapid antigen tests to go to those markets that were in more of a COVID emergency situation where those tests were more appropriate. What's disappointing is that as we've moved to a different phase in Scott Morrison's national plan that required access to more rapid testing, that those tests are not available and that they weren't more proactive in working with local manufacturers to get their products approved urgently, as the Biden administration did, I think, more than 18 months ago. Thank you.